Hi, everyone, and welcome to today's session. And again, welcome to our virtual conference, a spotlight on emotional well-being, highlighting the past, the present, and future. And again, welcome to our conference session. My name is Kathy Rivera. I'm the project coordinator of the Northeastern Caribbean Mental Health Technology Transfer Center, and I'll be introducing our session speaker for today. Today's session, titled Unlocking Wellness, Adding Dialectical Behavioral Therapy or DBT Strategies to Your Clinical Toolbox. We have with us Ms. Crystal Sosha. She is a PhD candidate and a senior training consultation specialist at Rutgers School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. Ms. Sosha's primary role includes providing in-person remote training, consultation, and technical assistance to New Jersey agencies that provide community support services. She has over 10 years of experience in the behavioral health field, delivering trauma-informed, culturally responsive, gender-affirming care, and supporting individuals in building a life worth living. Before joining Rutgers, she provided recovery-oriented services in supportive housing, intensive in-home and in-community settings, community mental health centers, integrated primary care, hospital systems, and private practices. She has received a 40-hour foundational training in dialectical behavioral therapy by the Linehan Board Certified Clinician and utilizes a DBT-informed approach within her work as a counselor. At this time, again, I want to welcome everyone joining us, and I'll turn it over to Ms. Osha.
Thank you so much, and thank you all for being here. If you know me, you know DBT is one of my favorite modalities, and if you don't know me, you'll find out shortly. So thank you once again for being here. I'm hoping that we can engage through the chat throughout this presentation, so feel free to use that chat as you see fit. Just to cover our learning objectives for today, what you will be expecting within this next about 50 minutes, really understanding the basics of DBT, including its history and its traditional format, as well as describing these 4 core modules, which we'll talk about in more detail, including mindfulness, the stress tolerance, emotion regulation, and interpersonal effectiveness. And hoping that you can at least take away one DBT skill within each module to add to your clinical toolbox, hoping that some of these are new skills, but really serving as a foundational overview and kind of a brief outline of what DBT really is and how it's best served. Okay, so what is DBT? Just to get us started, as some folks are still trickling in, on a scale of 1 to 10, 1 being not familiar at all, 10 being extremely familiar with DBT, where do you land on the scale? And let me know in the chat. So 1, not familiar at all. 10, you're very familiar. You're an expert. You can do this presentation too. Okay. Awesome. I'm seeing mixed responses, so thank you for that. Okay. So we're going to take a look at what this really looks like, and I'll just provide, again, just this overview of what DBT is. So as we know, the D stands for dialectical. For those of you who don't know, dialectical is really the synthesis or integration of opposites. And this includes a combination of both acceptance and change. And so this idea that opposites can coexist. And in DBT, Marshall Linehan, the founder of DBT, talks about acceptance as mindfulness and distress tolerance, or the strategies within those modules, and change being those emotion regulation and interpersonal effectiveness modules. The B really stands for behavior, and as we know, DBT does require a behavioral approach. This means that we assess the situations and the target behaviors that are relevant to the clients that we serve in order to assess their goals and figure out how to help them solve the problems in their lives. So this gives hope to people that behaviors are changeable. And therapy, ultimately, this includes this combination of both individual therapy, group therapy, and we'll learn a little bit more about those four DBT modalities in just a moment. But DBT really is this comprehensive evidence-based treatment that helps people to navigate difficult emotions, stress, interpersonal relationships, and impulsivity. Okay. So some of its history, DBT was developed in the mid to late 19th century, founded by Dr. Marcia Linehan and her colleagues, really first developed for women who engaged in self-harm behaviors and suicidal behaviors, and is most empirically validated for those who have a diagnosis of borderline personality disorder, but has since been applied to so many other populations. And there's so many adaptations that exist. So I'll share a resource, but there's DBT for substance use, there's DBT for disordered eating, binge eating disorder, bulimia nervosa, for children and families. There's a manual for corrections, PTSD, inpatient, and more. So again, this was really founded by Marsha Linehan when she was studying suicide as a suicide researcher. And this was prior to her knowledge about borderline personality disorder, where she discovered that cognitive behavioral therapy alone did not work as well as expected with individuals with borderline personality disorder. And so clients experienced the change-focused interventions as invalidating. They felt misunderstood, criticized, and these feelings really led to withdrawal, early termination from services, perhaps anger towards their therapist, or a fluctuation of both those extremes. And so later on, we know that Marsha Linehan actually did share some of her personal history related to mental health, and shared being diagnosed with borderline personality disorder herself, where she reported when she was 19, she was identified as the worst patient on the ward. So she realized there was too much focus on validation on the one end, or this acceptance end, and there was too much focus on the behavior change end and being too solution oriented that clients felt invalidated even if they were given skills. So she found that treatment may have lowered symptoms, but it didn't reduce their suffering. And so although these original interventions were targeted for, again, either behavior change or validation, she found that neither behaviors nor supportive therapy was effective. So the behavioral approach or the validation approach, she realized that combining those two together, which is again really where dialectics comes from, and dialectics tells us that clients need both validation and they need to be taught skills. So validation is that acceptance and skills is that change piece. So again, that's how really the development of DBT came from, with this combination of that behavioral piece, combination of mindfulness, combination of a humanistic approach, and really emphasizing both supporting the client's change process and validating them throughout. And so DBT in its original format includes these four modalities. So traditional DBT includes individual DBT sessions, so one-on-one sessions with your therapist, where you're reviewing a diary card, and what that looks like is helping this person to really outline all of their emotions, the urges that they're experiencing related to substance use, suicidal behavior, self-harm, disordered eating, and so on. And you're meeting with this therapist weekly to explore what you have identified on that diary card within the past week. The second piece is those skills groups. So these are weekly skills groups and focus on the four core modules of DBT, which we'll talk about in just a moment. We'll also talk about what it looks like to engage in phone coaching, which is providing clients with support between sessions. And so this is particularly in those times of crisis where you are supporting a client in using a DBT skill so that they're able to be effective in that moment. The peer consultation group or therapist consultation group is really a support group for DBT therapists to discuss cases, share strategies, offer each other support, and make sure that they're adhering to those DBT principles. And again, DBT in its traditional format does take about 6 months to a year. But each module can take between or up to 6 weeks. Although there's so much research to support that DBT is adaptable in community settings, and people do really benefit from the skills. I will share some resources at the end that are very much helpful in starting getting to use DBT in the work that you do. So again, DBT is really specifically for individuals who meet criteria or have features of borderline personality disorder. They may also experience some of the following. So they may have self-harm behaviors, a history of recurrent hospitalizations or suicide attempts. They may experience some of these really intense symptoms that make it difficult for them to engage in a traditional process group. It's difficult for them to stay grounded in that group. So they may be more helpful in a DBT group setting. Individuals may have a history of substance use relapses. They may, again, engage in all of these self-injurious behaviors, may be identified as high risk to the treatment team. They may require daily check-ins, and they also may have deficits in those skills modules. So it could be deficits in at least 2 or more of those modules, and we'll talk about those in just a moment. But as I just mentioned before, DBT is so applicable to so many populations and has been very much adapted into a variety of settings. And so the foundation of DBT really lies in being as skillful and as effective as possible. And so DBT is this set of skills that are grouped together to achieve a specific goal. And so these skills can help people, again, in being effective or ineffective, or have them move away from those ineffective behaviors. And so when we talk about skills and really the foundation of DBT, we talk about biosocial theory. And biosocial theory tells us how and why people have so much difficulty with emotion regulation and behavior control, coming from a combination of both biological factors and environmental factors. So this theory does state that each of us is influenced by our biological makeup. So thinking about that nature versus nurture impact, which then influences our behavior, which then influences our environment, and in turn reacts to and influences us in this never-ending transactional cycle. And some people actually experience higher levels of emotional vulnerability. So this inherent nature that they experience biologically, they are more sensitive to those emotional stimuli. And so this heightened sensitivity can lead to more of those intense emotional responses. And this is the people that really can benefit most from DBT because they have high sensitivity and high reactivity, and they also have a slower return to baseline, meaning it's harder for them to regulate their emotions. It's harder for them to get grounded once again. A few other points I'd like to just really emphasize that this is much harder for some people than others. And these aren't clients that are trying to make your job or your life difficult. And maybe you're thinking about a client that you have or someone that you've worked with in the past, and maybe you felt some frustration working with them. And I really just want to say that we know that all of these behaviors come from somewhere. And it is really hard for some people to regulate their emotions than others. These feelings and behaviors are not random, and each emotion has a function. And emotions allow us to communicate to ourselves and others. So inherently, this person is trying to get a need met in some way, and the only way that they know how. And then the last part is this invalidating environment, which makes it difficult for people to regulate these emotions. So what exactly is an invalidating environment? What comes to mind? And I share this sad kitty as part of this image that we'll paint, but what comes to mind when you think of invalidating environment? See, belittlement, not supportive, being told to get over it. Absolutely. Might include someone saying, just breathe, you have nothing to cry about. non-affirmative, not listening, not valuing someone's feelings, even if you don't understand them. Absolutely. So there's this level of dismissiveness, no regard for how this person's feeling. Right. And so invalidating environments from the eyes of Marsha Linehan include some of the following. So really those environments that consistently fail to acknowledge or validate a person's emotional experiences and can undermine their ability to understand and manage their emotions. And so I like to also say that these environments don't have to be abusive environments, but environments where someone even doesn't fit in. All of the above, minimizing thoughts and feelings, yes. So the first one that Marshall Linehan talks about is this punishing of expression of emotions, especially in public. And even thinking about within the home, and I like to think about this from a child perspective, or thinking about when, if you're working with adults, when that person was a child, this might look like telling this person to, go to their room until they're able to stop being angry. Oversimplifying problem solving. So think about the challenges that the clients you see face, and think about if you work with parents, if you work with children or adults, maybe those moments where someone's saying, well, if she would just try, if she could just apply herself, she could do it. This includes saying emotions are weird, wrong, or bad. So this includes, again, from the child perspective, telling a child that is such a dumb thing to say. So now this person is an adult, feeling shameful and afraid to express how they're feeling because these emotions are weird, wrong, bad, and also often attributed to socially unacceptable traits. It denies or discounts an individual's personal emotional experience. So someone mentioned something similar to the chat in the chat. So not valuing someone's feelings, telling this person, you don't feel sad, you're angry. No one else would feel that way if they were in your shoes. It reinforces the escalation of emotional responses. So maybe this adult is paying attention to the child's escalated emotions only and intermittently. So while communicating these emotions are unwarranted, this person, for example, is ignoring screams for help when a child falls off of a tricycle until the screams get so much on this parent's nerves, so to speak, that the parent then responds in a cold, stern manner when this person was already asking for help early on. And lastly, it says emotions should be coped with without support. So this might look like if you're going to keep crying, go to your room and come down when you get a control of yourself. And so this is where a lot of that emotional suppression comes in, the inability to figure out what I'm feeling. I don't know what's happening inside of my body. I don't know what this is, and I'm not supposed to ask for help. I'm not supposed to do anything about it. I can't ask for support because I'm not going to get the support that I need. I have to figure it out on my own, but I have no idea how to do that. So this environment doesn't teach individuals how to label those emotions. It doesn't teach them how to name those emotions and regulate those emotions. And so now we're left with someone who doesn't trust their emotional experience. And so it becomes very difficult for those individuals to regulate distress or solve problems or communicate effectively. And the last piece here, it's really the combination of emotional sensitivity plus that invalidating environment and these ongoing transactions over time that lead to this increased or exacerbation of symptoms. So one or the other may not be necessarily enough to fit this DBT criteria, but the combination of the two is really what we see that's increasing these symptoms. Okay. Is anyone here familiar with dialectics? I'll give you an example. If anyone recalls, at some point in the past, I don't know, 5, 10 years, there was a trending discussion about the black and blue dress or the white and gold dress. So there was an image that was posted, and some people were seeing the black and blue dress, some people were seeing the white and gold dress. Both were true. And Sandra, yes, there is a piece to that that has to do with dialogue, yes. So dialectics really tell us that two opposing truths can be true at the same time. It may be hard for us to find the other truth, although there can be a synthesis of both perspectives. It's almost like the opposite of black and white thinking, or staying away from the extremes, where instead of either or, it's both and. It's like brain yoga. You're balancing both sides to become more flexible. So you're helping clients to really let go of that black and white, all or nothing thinking, those rigid, extreme thoughts. And this is really much of, again, the framework of DBT. When life presents you with problems, what are some of your options? Just thinking about if you have a problem and you are looking to solve it, what's perhaps one of the first things that you might do? Google. So quick to Google. Everything's on Google. What else? Talk to a friend, ask. Right. And so in DBT, we talk about a few different ways to solve a problem. And this is helpful to know, especially when supporting clients, because we want to present them with all of the options. The first is solving the problem. You can, if you have all the details of the problem, maybe you change the situation, you avoid, leave, get out of the situation. You're solving the problem that's causing this pain and suffering. If you can't solve the problem, there could be a way to feel better about the problem. So we can try changing our emotional response to that problem using emotion regulation skills, which we'll talk about. You may accept and tolerate the problem, which is where distress tolerance skills come in. You are accepting and tolerating both the problem and your response to the problem. Mindfulness falls a bit in here as well. The last part is to stay miserable and not use any skills and possibly make things worse, use ineffective skills perhaps. So those are still skills. For example, using substances, engaging self-harm, that is a skill to navigate some of that distressing emotion, or perhaps you're using skills ineffectively. And so Marsha Linehan talks about the combination of pain plus resistance, in her words, leads to suffering, but pain and acceptance leads to freedom. Thank you. I see in the chat, think about my options. Is there a problem or not? Yes. So within DBT, these are the 4 core modules, and all of these skills really help to empower an individual to be as effective as they can be in all areas of their life. And so I'm going to talk about these in just a moment. I won't spend too much time on this slide, but you'll see I broke them out in this order. I do find covering mindfulness as first and foremost. It is the most prominent skill that we need in order to handle distress. We need mindfulness to regulate our emotions. We need some awareness of the present moment to be effective in our interpersonal relationships. So mindfulness really teaches us how to do some of the following. It helps us to teach clients how to reduce suffering and increase happiness. Again, it's really the foundation for all other skills, which we'll be discussing today. And it really comes from noticing when the mind wanders and bringing it back. Not quieting or emptying the mind. It's impossible to let go every single thought you're thinking. You're probably thinking at least a few other things in this moment. If you're not, you're doing a really incredible job at being mindful. We're also teaching clients to increase control and awareness of their minds and focusing again that attention on the present moment, experiencing reality as it is and letting go of judgments. Okay. And so in DBT, one of the first skills that we cover again within the mindfulness module is wise mind. And everyone has a wise mind. It is not our job to tell someone what their wise mind says, but rather asking them, what does your wise mind say? And it's never in a shaming way. If someone is engaging in, let's say, they come to you and they told you that they engaged in a self-harm behavior last night, and you want to check in with them and explore and assess what contributed to that behavior, you wouldn't approach them and say, well, what would your wise mind say? Um, it may not be so helpful. It may be helpful to walk through with that person some of those steps and encourage this person to explore what would your wise mind say in a really neutral way. Is anyone familiar with wise mind and the states of mind? And maybe you have a different name for your own wise mind, but let me know. And so with the states of mind, we talk about reasonable mind, emotion mind, and wise mind. And if you're not familiar, have no fear. So with reasonable mind, or this left side of the Venn diagram, this is very much our rational mind. We're task focused, ruled by logic, facts, reason. And reasonable mind alone can allow us to lack empathy and compassion for ourselves or others. And I'll give an example in just a moment. Emotion mind, on the right side of this Venn diagram, is mood dependent, emotion focused. And without emotion, we lose connection to meaning. So there's no logic here, but without this, there's no meaning. And with wise mind, which is really our kind of intuitive, the middle path between those two, it's the wisdom within each of us. When we're able to see the value of both reason, both emotion, it really is where our values live and who we are as a person, how we walk through the world. So, for example, for someone, I give this example just as a concrete example, someone who's in their reasonable mind, let's say they're thinking about buying a car, they go to the dealership, they do all their research ahead of time, they look up all the facts about this car, but when they get to the dealership, they don't test drive the car because the facts say it's a great car. In our emotion mind, we see a car, we saw it on the streets, our best friend has it, we love it, we also want to buy it. So it's pretty, you love it, you buy it. In wise mind, we're now combining those two. So we're aligning our preferences and exploring the research. We're test driving the car. We're seeing, is there enough room in the trunk to fit our stroller for the kids? We're understanding the monthly payments. I realize in this economy, we may not be buying a new car, but after all of that combined, you can then buy a new car. So we're helping someone access their wise mind. And again, this is by saying, is this something that your wise mind would do? Is this thought, action, plan, wise mind? Okay. Distress tolerance. And I put this puzzle here because I just came up with this. So distress tolerance is when you are playing a puzzle. It's a 500-piece puzzle. Has anyone ever done a 500-piece puzzle? I can say that I have. And you are one piece away from finishing this 500-piece puzzle. And your cat, your dog, your now enemy destroys the puzzle right before your eyes. You are so close to finishing. And this puzzle is not able to be fixed in that moment. There's no way that you're going to put 500 pieces together back in a snap of a finger, but you will be able to start with one or two. And maybe the corner is still intact and you are going to start rebuilding that corner. So this is where these skills come into play. You may not be able to solve the problem in that moment, but you will learn how to get through it. And so distress tolerance is broken down into these two groups. So crisis survival skills, which help people to tolerate painful events, urges, and emotions without making them worse. And then reality acceptance skills. So you're teaching individuals to reduce suffering by accepting reality. And the goal here is to reduce pain to a manageable level and avoid destructive behaviors. So I often emphasize these skills are working if time passes and you have not done anything to make the situation worse, even if you don't feel better. So that's a big key. You may not feel better, but and you didn't engage in self-harm. You didn't walk to the liquor store to get a bottle of liquor. You didn't do any of those destructive behaviors that usually you would turn to, or those ineffective behaviors. Thank you. I just thought of that the other day. I thought it was pretty good. Okay. So one of the distress tolerance skills, which you may know and love, self-soothe is something that comes up quite often if you are a clinician, or if you're a student, or if you're someone out in the world figuring out how to get through life, you often turn to perhaps a way to self-soothe. So self-soothing is really about comforting, nurturing, peacemaking, being gentle and kind with yourself. What are some things that you all do to self-soothe? And I'll give some examples in each category. We know self-soothing is helpful for, again, those with high levels of emotional vulnerability, especially to their emotion mind, people who may feel stuck in their emotion mind. These are skills that are quicker and faster acting than other skills. So for example, with vision, using those five senses, looking at the stars or nature, and these are skills that are so accessible in the environment. Hearing, so listening to music or nature. Smell, your favorite soap, lotion, candle. Taste, perhaps a favorite food or soothing drink, being mindful of this person's relationship with food. And touch, so maybe petting a comforting item, a blanket, a fuzzy friend. I love bunnies. I don't have one, but I do have a cat. An animal, a blanket. However that looks for this person, you're helping them tolerate the pain, again, without making things worse, and offering them with a sense of comfort. So what is a place that is safe and secure to you? This could be either real or imagined. And I see some examples: taking a nap, taking a hot shower. Those are good ones. What is a safe place that is safe? A place that is safe and secure to you, either real or imagined. My home, cuddling with my emotional support animal, my bed. Amazing. So another one of these distress tolerance skills is called improving the moment. And I brought up and asked about that safe place for you, or secure place, because the first part is talking about imagery and improving the moment by replacing immediate negative events with more pleasant or positive ones. So making the moment more positive and easier to tolerate. The first part is with imagery. So this can be used to help someone distract, soothe. This can be helping them create this safe and secure place, whether it's through conversation, or maybe you're helping this person, through artwork. These other pieces talk about some other ways to help improve the moment through meaning, finding meaning through a difficult situation, helping this person find the dialectic in the painful experience that they're going through. Prayer, which is helpful for some and not for others. If this person does have a connection to a higher power, it's not so much why me, but really opening them up to the present moment with relaxing action. So some of the things that you all mentioned, taking a hot shower, being able to do something that's different from the emotion that they're feeling. One thing in the moment, and this is really where mindfulness comes back into play. So it's one thing in just this moment, just this breath, focusing on one thing at a time. V for vacation. So this is like taking a vacation from adulthood. This is not telling your boss you're calling out tomorrow and you're going on a 2-week trip to Bora Bora because Crystal told me I need to take a vacation to improve the moment. No, this is something that doesn't last more than a day. This is something where you can remove yourself from technology, social media, and then encouragement. So these are all those things we talk about with positive self-talk, encouragement, saying kind and compassionate things for yourself, thinking of yourself as you would about a loved one or a close friend. How would you talk to a loved one who is experiencing the same thing as you in this moment? And I like some of the other examples. Emotion regulation. So this is the next part. And I thought of cupcakes for this one because I do love cupcakes. And emotion regulation is like this variety of cupcakes. One day we may feel like a plain cupcake. Sometimes we feel like the rainbow sprinkles cupcake. Sometimes we feel like the caramel nut cupcake. All of these feelings serve a purpose and a function. And emotion regulation teaches clients how to understand and name their own emotions. Oftentimes, again, they weren't taught, what am I feeling? What is this feeling that's coming up for me? We're helping them decrease that intensity of that feeling. And ultimately, all of this is then decreasing that long-term emotional suffering. And all of this goes back to being more mindful and being more aware of what is coming up for us and how we are responding to it. So with emotion regulation, we talk about the pleasant events list, and this is a list of 225 or more different pleasant events that Marsha Linehan outlined. That can be quite helpful if the person you're working with says, I don't have any ideas of what I could do. There's nothing that makes me happy. Thinking about activities they enjoyed as a kid or would like to re-engage in. We all need pleasant events in our lives, and it can be helpful to plan some of these in advance with a friend, with a partner. If you are someone who works in the community, can you engage in this activity with this person for the first time? And encouraging them to do this at least once a week. So I will also ask for to hear from you all. What are some of those pleasant events that you enjoy? And I'll share some examples for myself. Taking care of plants, as you see my background, going hiking, visiting an antique store. I'm big on thrifting and antiquing. And those are some of the things that I personally enjoy, but what I need is different from Sharon, is different from Kyle, is different from each person. So this is important to help people to really identify what are things that they can do that will bring them joy once again in their life. Okay, jumping into values, which I think is often overlooked, but is so important when we talk about DBT. It actually is an emotion regulation skill. And DBT helps people to really achieve wellness through the lens of building a life worth living and creating a life that is fulfilling and meaningful and aligns with this person's values and goals. So what do you value? I apologize, I'm hopping right through these slides. Thank you for sharing some of those examples. I see you spending time with friends and family, God and family. Maybe you value achieving things and being successful. Maybe you value contributing to a larger community. I see mental health. Maybe you value being part of a group. And so keep some of these things in mind because it's so important to have this conversation with the people that you're working with. And so in emotion regulation, we talk about accumulating positive emotions in the long term. So pleasant events can be short term. These positive emotions can be long term. And so long term happiness in DBT's lens really means that we're experiencing life as worth living and we're living our lives according to our personal values. So some questions that can be helpful to ask the people that you work with. What in life are your highest priorities? What in life really matters to you? And sometimes it's hard for people to identify, like, oh, Crystal, nothing matters. I don't really care about anything right now. exploring if there's anything that this person valued when they were younger, when they were a teenager, as they were growing up. Where do they need to make changes in their life so they can do things that are important to them? And so helping this person to really identify, how can I do things that align with my values? I find this so helpful as someone who works with people with eating disorders. This is a great tool to bring up, especially if your client, for example, a client who values thinness in a world that's dominated by the ideal of being thin. Maybe exploring with this person what their values are. And if this person says kindness and self-care and health and mental health and women's rights, um, we typically talk about, okay, so you shared that kindness is something that you value. I wonder how restricting or engaging in some of these disordered behaviors like over-exercising aligns with this value of being kind. And oftentimes through a larger conversation, we know restricting does not align with being kind to your body, doesn't align with providing your body with kindness and compassion. So it may not be that wise mind decision. And absolutely a great tool for providers feeling burned out. There's so many more questions on this handout as well to help you really align with who you are and who you want to be and how you want to walk through the world. The last emotion regulation skill is this mindfulness of current emotions, which is often coined as riding the wave. And so what we help people do here is acknowledging just as the ocean changes, so do our emotions. And it's normal for people to experience urges to engage in a previous ineffective behavior, whether that's substance use, self-harm, and noticing this feeling as it comes up. A lot of it is noticing, delaying, distracting, being mindful of these sensations that are coming up, learning how to float with your feelings, kind of letting them come and go. And acknowledging that this feeling will eventually pass. Just like waves crash, so does this feeling. So again, a lot of this is making sure that you're reminding the people you work with, they are not their emotion. And oftentimes we have individuals that get stuck to that thought or that feeling, and it's helping them to notice and acknowledge that feeling, letting that feeling come up for them. It may feel really uncomfortable, acknowledging that that feeling will pass as well. And it may need additional support with other skills that we just mentioned. I like this poem and I'll share it in its entirety as a way to talk with clients and also share how it's very natural for us to want to resist and push difficult feelings and thoughts away. If you're feeling something uncomfortable, you don't want to feel it. You want to maybe go back to your work and be productive and not think about all the things that you have to do later or the crisis that's happening outside of work. But instead, we talk about wanting to invite these feelings in and allow them to be present. So this poem by Rumi, titled Guest House, says this: being human is a guest house. Every morning a new arrival, a joy, a depression, a meanness, some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house, empty of its furniture. Still treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes because each has been sent as a guide from beyond. So I hope that that can be used for yourself or with a discussion with your client to really notice how they feel these feelings and allowing these feelings, just like this guest house, to come and to go without attaching to them. And this practice really encourages us and our clients to meet these thoughts and emotions with courage, with warmth, with kindness. Okay. Interpersonal effectiveness. I find this to be one of the more challenging ones, and probably one of the last ones that I discuss with clients. So interpersonal effectiveness really helps people and teaches clients how to be skillful in getting what they want or need from other people, strengthen those current relationships or perhaps end destructive ones. And there's also a guide on safety, especially if this person is involved in a domestic violence situation, being mindful that safety always comes first, and creating balance in relationships. So this helps individuals in building and maintaining some of those effective relationships. And so these three goals in interpersonal situations. So whether or not I get the results or changes that I want, all three types must be considered. So objectives effectiveness talks about the Dear Man skill, and we'll get to that in just a moment. The Dear Man skill with objectives effectiveness speaks to what result or change do I want from this interaction? So what outcome do I want from this other person? It is important to be as clear and specific here, helping this person to really identify what is the outcome. The clearer this person is with what they want, the clearer they'll be able to apply this Dear Man skill. With relationship effectiveness, a lot of this is teaching the person how to validate both themselves and the other person. So how do I want the other person to feel about me after this interaction is over? And we never want someone to sacrifice their own values or their own needs for the relationship to go smoothly. You want this person to learn how to either develop, improve, maintain this relationship, perhaps understand the other person's perspective, maybe exploring how this person changes the way that they are able to meet your needs. And then the last part is self-respect effectiveness, or the FAST skill. And we'll only talk about one of these today, but this last part is, how do I want to feel about myself after the interaction is over? And so I often encourage clients to think about these three questions. Is there something that I need to change? What do I want to change from this? And especially if this person is looking to keep the relationship, the likelihood of this person engaging in a for lack of better words, like a screaming match or a dialogue that is destructive, that may likely cause this other person to struggle with maintaining a relationship with them, which may require a repair of that relationship. So helping the person that you're working with explore what result or change do I want? How do I want this other person to feel about me? And how do I want to feel about myself? Again, going back to those values, if I value kindness, is there a way that I can still approach this conversation with kindness? And so I'll give the example for, let's say you're working with a client who is working on an ongoing recovery lifestyle and is approached by a friend who engage in substances. So thinking about this from these three questions with the objective might be to not engage in substances. This person knows it may put them at risk for possibly engaging in illegal activities. They have a fear of engaging with police and becoming arrested again, and they're looking to get a job, so they don't want to engage in substances. That's the objective. The relationship effectiveness is maybe they do want to keep a relationship with this friend. This is someone that they've known for all their life, and they really want to keep that relationship. And with that self-respect, again, tying back into those values, we want to make sure that this person, for example, if they say they don't want to go against those values of their goal of maintaining an ongoing recovery lifestyle. So in this case, perhaps the person is inclined to choose the objectives effectiveness as most important. They don't want to engage in substances with this person, and that is the outcome that they're looking to achieve. So in order to do that, we are now helping this person with this Dear Man skill. And DBT really outlines Dear Man as the following. So D for describe, express, assert, reinforce, staying mindful in that conversation, appearing confident. We talk about maintaining that broken record, and then negotiating if needed. So when this person needs to um, maintain that objective, or they are looking to get something from another person, they're looking for support from someone. This could be, asking a partner to help with laundry. This could look like, I've had clients use the Dear Man script when asking their medical provider for a new medication, explaining how this medication is giving them side effects and they don't feel comfortable with it. So with this skill, we are helping this person describe first and foremost, describing the situation with only the facts. So we are not including any judgments. We're not including any opinions. This is factual as the situation is. And we're not asking for anything yet in this one. With express, now you're helping this person use I statements, expressing their feelings, allowing for them to take accountability, or allowing for them to share with the other person what's coming up for them. So this is the classic I feel fill in the blank. With assert, now this person is going to ask for what they want, or if they're looking to get a need met. Again, this person on the other end can't read this person's mind. So we are asking for what we want. Reinforcing, so reinforcing the person ahead of time by describing how it could be helpful for both of them. And so this can look different depending on the situation, but it often talks about how it's a win-win for both parties involved. Staying mindful is really more about staying on track with the conversation, repeating what you want over and over, keeping that broken record. If this person starts talking about the weather, if this person starts talking about other issues, you want to keep asking and keep repeating and being mindful that this conversation is on track until you reach a solution. Appearing confident. So that's regardless of how you feel on the inside, this can be so challenging because we might be shaking in our boots. Maybe this person that you're working with is not someone who engages in these kinds of conversations. They're used to being someone who would rather silence their voice. And in this moment, you're helping them to appear confident and continue to stay on track, as I mentioned, being very clear about what they want. With negotiating, sometimes this is needed if the person on the other end, maybe there's a moment where you can offer some flexibility. So asking if this person has any other ideas about what you think you might do, or how do you think we should go about this? How can we solve this problem together? And so if we're looking at, in general, we hear this come up often in interpersonal relationships, meaning intimate or romantic relationships. Maybe this person is describing, I've noticed we've been spending less time together due to your increased work hours. So this person is working late or coming home late. This person is now expressing, I feel lonely and miss our quality time together. This person wants to assert, so I would like us to set aside one evening a week to go on a date night. With reinforce, this might look like this will help us stay connected and I want to strengthen our relationship. And so that's kind of the foundational approach with that. It can be, easier said than done. I've often helped clients just write it on a piece of paper. We'll role play it together. We'll see how the other person reacts. I can be the person using this script or on the other end. And so again, this is one of the more challenging ones, but can be so helpful in so many different ways. Okay, wrapping up, and I'll share some resources in just a moment. So I wanted to acknowledge again some of the following. DBT is both supportive or validating and behavioral and skill oriented. So we're helping people with both acceptance and change. We know the mindfulness module helps the person to really stay present in that given moment and is the foundation for all of these other skills so that they can be effective in future decisions and make sure that they are accessing their wise mind. With distress tolerance, we're helping individuals to survive a crisis without making things worse. And this is specifically for crisis survival skills. There's a lot more on the other half, which are the reality acceptance skills. Emotion regulation skills help individuals to manage those really intense emotions, label them, identify them, understand them. And also, again, we talked a little bit about those values. So, connecting those values with this person's life worth living. Interpersonal effectiveness skills we briefly touched on, but really helping people to balance their needs, the needs of others, or their self respect. So, making sure that they are mindful of that decision if they are someone who, again, wants to um, find an outcome from that situation, maintain the relationship, or maintain their self respect. And then the last part, really acknowledging DBT takes time, energy, effort, commitment. It is not something that happens overnight. It is very difficult. And again, clients may feel like things aren't working and that these skills are not effective, but reminding them if they are not engaging in those ineffective behaviors, these are those small victories to validate and to praise and to explore how did you do that?
Thank you so much, Crystal, for providing us with a wonderful
Sure.
session on DBT. Unfortunately, we have reached the time limit for our session, so we'll have to wrap up now. Again, I just want to remind everyone that all of the recordings and slides will be posted on our website as a resource. And I just wanted to thank you, Crystal, for speaking today and sharing these principles of DBT and how to use them. And I hope everyone has found this webinar useful in your work. Thank
Thank
you.
you, everyone.